Right now, another coronavirus death, what the governor is doing to keep you in your home.
We're constantly hearing about the coronavirus, but do you know what the virus actually does to your body and why it's so deadly? I'm Annie Johnson, and I sat down with a doctor for the complete breakdown.
Time now, 6:30 back here in Montana this morning. Chat Lehman, Caitlin Corbett, Matt Elwell.
There's nothing better than a little mystery. I love
mystery. You don't know how the block is going to start, but right now we're going to start with weather. Still snowing. Going to snow for a little while longer.
I want to talk about the snow, and that's very important. But did you guys feel the earthquake?
No.
I did not either. I did look out the window and I saw snow fall out of the trees.
That's crazy.
That's how you knew.
I was like, wow, that was interesting. Yeah, so 6.5 magnitude earthquake, about 45 miles west of Challis, Idaho. So that's a long way from here, but it was felt in southwest Montana. Snow and ice on the area roadways, Bozeman Pass, Homestake Pass, and the Gallatin Canyon, all dealing with snow and ice early this morning. Leave some extra time. We do have some areas dealing with some pretty hefty snow showers this morning, 3 to 4 inches in a few areas, some areas 1 inch to 2 inches. Just depends on where you are, but our temperatures are cold this morning, and snow and ice is on the area roadways. Visibility has gotten better. Butte right now sitting at 6 miles. We've been down to 2 miles in Belgrade. Off and on snow showers expected today, but they should be lighter. We're not talking so much accumulation. We'll talk more about your forecast, of course, from the Billy and Auto Weather Patio in just a few minutes.
I like the use of hefty there.
I know, right?
Good use of the word.
There you go. 6:31. Here's your update. Some more numbers for you. We have 21 new cases of coronavirus in Montana. According to the State Department of Health, 198 cases have been confirmed, 5 deaths. No word on that latest death happened, by the way. Gallatin County continues to lead the state, 74 cases, which includes 7 new cases as of yesterday. Silver Bow County added 1 new case for a total of 10.
Madison County has another 2 cases, now at a total of 6. A worker at the Madison Valley Medical Center has also tested positive for COVID-19. That worker is now isolated at home. 15 people have been hospitalized in the state. Earlier yesterday, Governor Steve Bullock announced that 32 people have recovered and have been released from isolation. 4,558 tests have been completed as of yesterday afternoon.
Now, of course, today is the first of the month, and you should take your responsibility of payment seriously. But Montana Governor Steve Bullock yesterday afternoon said if Montanans are being asked to stay home, they should have a home to stay in. MTN's John Amy covered a press conference.
Governor Steve Bullock announced plans today here in the state capitol during a news conference in which he hopes will help people going through economic difficulties during his stay-at-home order over the coronavirus outbreak. The governor ordered that renters will not be evicted from their homes or have utilities cut off while enduring economic hardship during the stay-at-home order.
They shouldn't also have to worry about whether they can keep a roof over their heads or if they'll have running water. They shouldn't have to worry about having the heat turned off if they can't pay the rent or make their monthly utility bill.
The governor will also use the National Guard to monitor people coming into Montana from out of state to try to stop the spread of the coronavirus.
We've also authorized the National Guard to conduct temperature checks in Montana's major airports and major rail stations. They'll also be screening for potential exposure history for travelers arriving in Montana from another state or country at our airports.
The governor also addressed his concerns about getting enough supplies and COVID-19 testing kits for the state.
I don't want a day to go by without being able to perform tests.
In Helena, John Amy, MTN News.
Time now 6:34. We're all being affected by the coronavirus these days, but how many of us have a clear understanding when it comes to the virus itself? MTN's Annie Johnson sat down with a doctor at the Bozeman Health Deaconess Hospital for a full explanation.
You hear the word coronavirus dozens of times throughout the day, but do you know what the virus actually does to your body and why it's so dangerous? Let's hear from the doctor.
Medically, it's a virus in the family or class of corona that is a group of viruses that we see routinely But unfortunately, a group of people will actually get it, so it disrupts the function of their lower respiratory system, their lungs.
And Dr. Sullivan shows us what that can look like internally.
And then you can see this white stuff that's here, that's not up there. That is the effect of coronavirus.
According to the doctor, a coronavirus diagnosis doesn't mean a death sentence.
The majority will recover. And then there will be people who don't know that they have it. But even the symptomatic people, the majority will recover.
Dr. Sullivan advises people to take social distancing and CDC guidelines seriously if they want to stop the virus from spreading.
People who get symptomatic with it will have been shedding the virus before they came down with the symptoms. So that's why the social distancing is so important, too, because you don't know if you won't necessarily know if you have it, and you certainly won't know you've been shedding it before you get symptoms.
While there's still no cure, hospitals do have treatments for patients.
Treatment means, hey, there's something that we can give you that will keep you healthy and possibly alive as your body's going through the process of beating the coronavirus on its own.
The number of corona cases in Montana is continuously going up, but with safety measures put in place, Dr. Sullivan believes this is something we can overcome. Reporting at the Bozeman Health Hospital, Annie Johnson, MTN News.
6:36 now. The Bozeman School District is considering removing 2 levies from the May 5th ballot. One of those levies was for the high school district, the other for grade schools. School Board Chair Andrew Willett says the board agreed asking voters to decide on a tax hike during the coronavirus outbreak is bad timing. And Bozeman Mayor Chris Mell says the ballot measure is not a priority during the pandemic.
We're going to put all of our efforts into the COVID crisis, and so the education money that we had planned to talk to voters about learning what the district is will now be spent responding to this crisis that we have in front of us. That is the highest priority.
By the way, according to state law, the city of Bozeman had until February 20th to remove that measure from the ballot.
Well, this week marks the first week back to school for students in Bozeman, but it's in an entirely different way. Across the Bozeman School District, students K through 12 are engaged in remote learning, meeting with teachers over video, turning in assignments online, and doing it all outside of school. School board officials say each building, each principal, and each teacher are all working together, also remotely, to make sure kids have gotten their belongings out of school before the stay-at-home directive.
Well, as Montanans spend the next few weeks following the stay-at-home order, healthcare providers say it will be particularly important to take care of your mental health. DN's Jonathan Ambarian talked to 2 Helena organizations about what they're doing to help provide some support.
Health professionals say the major changes brought by coronavirus will put a lot of pressure on many Montana families.
Social isolation and distancing is often a huge stressor for people who already are experiencing anxiety or depression or trauma.
The effect may be particularly strong for children and teens.
I think for young children, probably the biggest stress is the disruption in routine. For adolescents, being isolated from their social group is incredibly stressful. I think as adults, we need to not minimize that.
Organizations say they're taking steps to make sure they're available to help if people call. Leaders at Intermountain increased their capacity to provide teletherapy.
Now that we're settling and struggling with staying in place, we're finding that it's hard for people to reach out, not knowing if they should go out. So it's even more important that we expanded our services so that we have more teletherapy.
Chaudere Children's Hospital is still admitting some patients, but they shifted much of their effort toward doing outpatient therapy remotely.
Actually, because we have reduced our bed capacity on the inpatient side, we now have more capacity for psychiatrists, nurse practitioners, and therapists.
Leaders say things like keeping a consistent routine can help, especially if children are struggling. But one of the most important things is simply to ask for support if you need it.
Don't try to tough it out, call for help.
In Helena, Jonathan Ambarian, MTN News.
Now, if you'd like more information from Intermountain or Chaudere, you can find links to them on our website.
6:39 now. With so much changing every day, it's nice to know that some things won't change for now. For example, local post offices around the country are stepping up to make sure people won't lose service or their mail during this time. The local post office in Belgrade said they're following CDC guidelines, making sure workers and the facility stays clean and making sure that your mail will be delivered.
Love that. 6:39 now. One of the few activities you can still do with social distancing. Go for a walk.
Across Montana, windows are being decorated and sidewalks are being chalked up to help bring a little joy during an otherwise difficult time.
Yep, spreading the joy in my neighborhood started as a simple idea between Tasha Herman and her 2 young boys. Decorate their home with some hearts to cheer up the people they saw walking by.
One of the boys' teachers encouraged Herman to create a Facebook group, which has since grown to thousands of members, some as far away as the Netherlands and the UK. Herman says it's been a great lesson for her boys. A small act of kindness can have a larger impact than you ever thought, and even though we're isolated, we're not alone.
It's important to kind of stop and realize that we're all doing it together. Like, this isn't one person going through it, it's all of us going through it. So if we can all do something together and like share that joy, spread that joy around, then it kind of brings us like almost together as one instead of thinking about us individually.
So if people would like to join the movement, all they need is some paper, a bit of chalk, and their creativity.
I love that. We are isolated, but we're not alone.
No, exactly. That's important to remember, because I know a lot of people, it's called FOMO, fear of missing out.
Yep.
A lot of people have that, but you know what? We're all doing it.
That's
so you're not
exactly
missing out on anything.
I love that. 6:41, let's take a quick break here. When we come back, good news if you filed your taxes in 2019, you don't have to do much to receive your stimulus check. We'll tell you why.
That's still ahead, and here's what's coming up on CBS This Morning.
Ahead on CBS This Morning, frightening stories from the front lines. We hear from an ER doctor who is more scared now than when he treated patients with SARS and Ebola. We also visit a small business that had to lay off most of its workforce and speak with people on both sides of that difficult decision. Plus, the former CDC director tells us what every American can do to stay healthy and stop the spread of the virus. And we talk with NBA star Kevin Love about his mental health struggles and how to get help coping with social distancing. All that coming up when we see you at 7.